Imagine this. You wake up one morning, look in the mirror, and suddenly something feels off. One eye looks normal, the other, the pupil looks bigger or smaller. Your brain goes into panic mode. Wait, why do my eyes look different? Relax, breathe, because this is where the story of Anisocoria begins. Anisocoria simply means unequal pupil sizes. Sometimes it's scary, sometimes it's totally normal, and sometimes it's your body trying to tell you something urgent. Here's the twist. In 1 out of every 5 healthy people, the pupils are naturally a tiny bit different, usually less than 1 millimeter. This is physiologic anisocoria. You're born with it or it shows up later, it stays pretty stable, and both pupils react normally to light. No pain, no vision changes, no danger. It's just your eyes being unique. But the story changes the moment anisocoria appears suddenly, gets worse, or comes with other symptoms. Now we enter the world of pathological anisocoria, the kind you should never ignore. Your pupils are controlled by delicate muscles in the iris, powered by 2 major nerve pathways, one that makes the pupil big, one that makes it small. If anything damages these pathways, an injury, pressure, a stroke, an infection, the pupils instantly reveal that something is wrong. Let's walk through the major causes of anisocoria. Sometimes a medication is the villain. Eye drops, motion sickness patches like scopolamine, asthma inhalers, even some chemicals or pesticides. If any of these get into one eye, boom, one pupil suddenly dilates. Then there's Horner syndrome, a small pupil, a slightly droopy eyelid, and reduced sweating on one side of the face. This happens when the sympathetic nerve pathway gets damaged. Neck injury, chest tumors, even carotid artery dissection. Another dramatic cause is third nerve palsy. Here, the pupil becomes large, the eyelid droops, and the eye points down and out. This can signal a brain aneurysm, a true emergency situation. Then we have Adie's tonic pupil, often seen in young women. One pupil becomes large and sluggish, barely reacting to light, but slowly tightening when focusing on a near object. Not dangerous, but definitely noticeable. Trauma is another major culprit. If the iris is torn from an injury or after surgery, the pupil may never change size normally again. Migraines can temporarily make one pupil huge. Uveitis can make it small. Glaucoma can increase pressure and distort pupil size. And yes, brain tumors or strokes can also cause sudden anisocoria. Now here's the big question. When is anisocoria harmless, and when does it scream emergency? If you ever notice unequal pupils with any of these symptoms, stop everything and seek immediate medical care. Sudden severe headache, neck pain or stiffness, nausea or vomiting, blurred vision, double vision or sudden vision loss, drooping eyelid, eye pain or extreme light sensitivity, trouble moving the eye, fever, confusion or altered mental state, weakness, numbness or paralysis on one side of the body. These signs can mean a stroke, an aneurysm, meningitis, or increased pressure inside the eye. So how do doctors figure out what's going on? An ophthalmologist or neurologist examines both pupils in bright and dim light, looks for how each reacts, and checks eye movements. They may use special drops, a slit lamp, and sometimes imaging, like a CT scan or MRI, to find the root cause. And treatment? It depends entirely on the cause. If it's physiologic, no treatment needed. If it's due to an infection, they treat the infection. If it's nerve damage, they manage the underlying problem. If it's from a dangerous brain condition, immediate emergency treatment can save a life. Anisocoria isn't just unequal pupils. It's your eyes whispering or sometimes shouting about what's happening deep inside your nervous system. So the next time you catch a difference in your pupils, don't panic, but don't ignore it either. Your eyes always tell a story. It's up to you to listen. If you found this video helpful, share it with your friends and family. You never know who might need this information. Drop a comment below and tell me what surprised you the most about anisocoria. And don't forget to like, subscribe, and hit the bell icon so you never miss simple, easy medical explanations like this one. See you in the next video.